You could bring them up. Let's say I'm gonna do L3, so I'm gonna move her up until I feel L4 move, and bring her down. I'm gonna switch my hands and have L3 and L2, and I'm gonna rotate you until L2 moves right there, and then I'm gonna come in here. I'm gonna forget my hands. I'm gonna bring her ASIS to my ASIS, and usually her foot will. Whoop.
Do you feel better? That's for free. It's fine.
Usually her foot will pop right up if I pull her real tight, but she's got a lot of flexibility. And then I'm gonna push her down. Okay. And then I could do contract, relax, push up against me, and then relax. We could do that.
This is the hypermobility. Trying to get that movement
Hypo.
back in right there.
Yeah. So you can do that with anyone with just a facet issue at the one segment. Your stenosis patients are gonna just have problems at all of those segments, so you don't even have to localize, you could just do that throughout their whole spine. Or you can lay them prone and do them. So your pavums turn into a treatment quickly. If it's tight, then you're gonna push on it into a grade 1 to a grade 4, depending on what you wanna do. Okay? If you have a patient with instability, what we talked about before, we're gonna do like more of a neutral strengthening program, because flexion and extension will both hurt. If you have a neck patient and they have a radicular problem, if I'm telling you they have numbness and tingling into the first 1 to 2 fingers, hopefully you know the cervical radic clinical prediction rule, and on the exam in the OSCE you'll be like, I'm gonna do a Sperling's and a distraction test. Maybe I'll do an upper limb tension test, and I'll be like, great, and then now what are you gonna do for treatment? And you might decide to do traction, because traction localized their pain on the exam. So traction is what you're gonna do, because you wanna localize the pain. If it's a headache patient with the pain behind the eye, you're gonna look at them for an exam technique. You could do chin tucks and lift, rotation and lift. Then rotate, and you can passively do the flexion rotation test, and then you can do some pavums to the C1 and C2, and then I can tell you that hurts, that causes pain, that's stiff, and then you can quickly turn that into your treatment. For an exercise technique for home, you could give them chin tucks, because chin tucks would stretch back there maybe. You could help them with, like, for your treatment technique, you could do a suboccipital release too. And you could teach them at home, they could put like 2 tennis balls or golf balls right there, and they can lay on it. That would be their self-treatment for home. That rotation one, so if you lay down and your knees are bent and you rotate, we're at the thoracic spine, giving them self-rotation moves. And if you're here and you're rotating, you're doing you have the lumbar involved.
When would you prescribe those if they're like?
I guess like if I had, you remember that was he an accountant? He's sitting at the computer and he's stiff everywhere. I would want to mobilize his thoracic spine, so I'd definitely give that to him. Or that lumbar or that stenosis patient, I'd be doing that to his lumbar spine. That whiplash patient, maybe I'd do that too, because mobilizing their thoracic spine can help with their whiplash symptoms. But I also do chin tucks, I think, with a whiplash patient. Let's see, what else could we do?